If your brain reacts before the world moves, is this still your choice? In 1986, a response time study was quietly renamed. No press, no scandal, just a new file path. 2 days later, the test chamber was reassigned to archival storage. The biometric data, once public, was rerouted to an inactive defense grant. No one complained. No one leaked. There was nothing to leak. On paper, the experiment never exceeded threshold deviation. But something shifted. In one log, a subject flinches at a tone that hasn't played. In another, their eyes move before the stimulus appears. Milliseconds, but measurable again and again. The lead researcher filed it as anticipatory error. But by the end of the week, he no longer had system access. The response was real. The trigger hadn't happened yet, and that's when they erased it. Berlin, 1986. In a third-floor lab tucked behind the psychology department of Humboldt University, the logs began to blur. The stated experiment was simple. Test subject response times under mild sensory suppression, a routine data collection. Nothing novel, but the biometric traces said otherwise. Over 3 consecutive trials, control subjects began showing anticipatory shifts, reacting before the stimulus arrived. Not seconds early. Milliseconds, enough to be noise, but the pattern repeated. One assistant noticed the trend and annotated the file. Within a day, the file was reassigned under a different code. 2 weeks later, the assistant was transferred out of department access. The test continued. But the logs began to contradict the methodology. What was being measured no longer matched what was being reported. And buried in the export directory was a folder labeled only with a date, one that didn't match any known session. From here, the trace begins. The vial was found by accident. Stored in a secondary cold room beneath the faculty archives, its label had degraded unreadable, except for a smudge of red tape used only during a specific 6-month window in 1986. The contents were not part of any listed compound. No record of withdrawal, no usage sheet. Under spectrometry, it defied expectation. Neural fluid or something close, but no degradation, no bacterial activity. And curiously, no pharmacological signature. A doctoral technician noted the presence of microstructures consistent with reinforcement agents compounds used to enhance synaptic recall. But no such agent had ever been cleared for human application under those codes. Further analysis showed a distinct pattern in the residue, not random dispersal, but a lattice. Fine, ordered, self-similar. A notation in the margins simply read, reflex arc activation without stimulant. No conclusion was offered. The sample was resealed and placed back under inert sample, do not dispose. This was only the first sign. It began, officially, in 1974, though even that date may be a reduction, in a now-defunct military rehabilitation wing outside Oslo, Norway. A set of trials was registered under the ambiguous title Cognitive Delay Reinforcement. The facility was cold, utilitarian, low ceilings, exposed piping, faint antiseptic in the air. One room had walls painted a dull gray, fitted with mirrored surfaces and sound-dampening tiles. At its center, a chair bolted to the floor, a headset with analog wiring, and a projector tuned to static. The lead was Dr. Clement Hartwig, a neurosensory researcher with a background in preconscious stimulus processing. His notes from Phase 1 describe unexpected fixation beyond threshold duration, suggesting that subjects not only endured repeated visual loops, they adapted. The audio logs include muffled laughter, confused technicians. One entry ends with a simple sentence. Subject anticipates loop. No mechanism explained it. The tapes were shelved, but the real origin lies deeper. The breakthrough came when Hartwig altered the loop. In Session 7, a small variation was introduced, a delay just 3 seconds off from the previous structure. The subject, without instruction, responded at the old time stamp, Not just once. Repeatedly, the sensors confirmed it. Elevated pulse, minor muscle contraction, and synchronized eye dilation all aligned with a tone that never came. This wasn't memory. This was prediction. More trials followed. The pattern held. Even with randomized delays, subjects reacted to what should have been next, as if the stimulus order had been internalized. Beyond recall, Hartwig marked the behavior as anticipatory residual encoding. It was a label without a mechanism. The phenomenon didn't fit reinforcement theory. It didn't fit any model at all. The results were prepped for external review, anonymized, cataloged, and timestamped. And then everything stopped. The stoppage wasn't announced. It unfolded quietly. First, the project archive was migrated to a shared defense grant under non-cognitive classification. The label changed. No longer reflex conditioning, but audiometric compliance testing. Next, all internal emails referencing Session 7 and beyond returned empty headers. Hartwig's calendar entries were scrubbed. Meeting minutes ended mid-sentence. When two technicians attempted to pull baseline comparisons from the audio logs, the file tree rerouted, directing them to a defunct speech therapy module last modified in 1971. Even physical artifacts began disappearing. The chair was removed, headset dismantled and relabeled as surplus. The room itself was converted into a storage closet for archival film reels. Hartwig never published again. His name, still present in earlier academic papers, quietly ceased to appear in citation indices after 1976. No press release, no scandal, just silence. But silence left a darker void. Years later, fragments surfaced, not in research journals, but in hospital case notes and rehabilitation assessments. A 39-year-old patient in Lyon began speaking in rhythmic stutters that mirrored early reinforcement tone patterns. The structure wasn't random. It mimicked loop timing down to the millisecond. In Mound, a former subject enrolled in a sleep regulation. Study developed persistent aversion to soft blue light, the exact wavelength used in Hartwig's initial sessions. No known trauma, no conditioning history. But the reaction was automatic, measurable, and intense. A third case, documented in an unnamed behavioral integration center, involved anticipatory flinching. The subject responded to projected light patterns before onset, not always, but consistently enough to flag as anomalous. Each case appeared isolated, different regions, different contexts. But the anomalies shared a quality, subtle misalignments between stimulus and response. Gradual, involuntary, and reproducible under specific conditions. Here, a pattern begins. Patterns like these rarely hold, unless they've appeared before. In 1962, a trial in Montreal studying preconscious memory drift abruptly terminated after 6 subjects began exhibiting synchronized microresponses identical down to heartbeat intervals. In 1991, a university in Osaka reported an internal memo on linguistic anticipation anomalies during speech pattern modeling. The documents were never published. And in 2003, a Chilean IG study on sensory desensitization logged an unexplainable spike in neural feedback loops. The researcher marked it as equipment failure, but only after the raw data was pulled from the server. 3 decades, 3 continents. 3 different terminologies, but the same drift. The variables changed. The outputs didn't. Each time the project paused. Each time the records faded, and then it returned. In 2019, at a closed session conference in Rotterdam, a neuromodulation lab presented a new form of cognitive feedback therapy. The slides were clinical data points, neural overlays, patient response graphs. But one researcher, reviewing the session later, noticed a detail buried in the graphs. A curve, clean, recursive, and unmistakably similar to Hartwig's reinforcement slope from 1974. The presenter was questioned. He denied any prior knowledge of Hartwig's work. There was no mention of anticipatory feedback in the paper, but the data matched interval for interval. peak for peak. When the pattern was superimposed onto the archived charts, the alignment was precise, not inspired. Identical, the presenter revised the dataset before it was published. The original version was quietly withdrawn from the repository. The phenomenon had returned. But it no longer wore the same name. The question is, what does it mean now? In post-clinical reviews, something subtle emerged. Across several studies, none connected on paper, a small, consistent anomaly appeared in response time data. Patients engaged in pattern-based therapy began reacting a fraction too early. Not in conscious tasks, but in reflexive ones. One neurobehavioral team in Utrecht noticed a statistical drift in decision latency. Patients paused before non-stimulus events, as if predicting a prompt that never came. Elsewhere, in cognitive empathy assessments, subjects demonstrated heightened synchrony with test administrators echoing tone and posture with unnatural precision. These weren't impairments. They were adjustments. No red flags were raised. The deviations were within acceptable error margins. But plotted across time and geography, a quiet trend emerged. Increased pattern conformity, diminished novelty in spontaneous behavior. The mechanisms remained opaque. The outcomes subtle. But the final answer lies elsewhere. The experiment wasn't about control. It was about sequence. Hartwig's trials didn't condition behavior. They restructured the order of perception, embedding a rhythm beneath conscious recognition. A rhythm the brain began to follow, then anticipate, then require. By decoupling stimulus from response just slightly, the protocol rewired timing expectations. Not enough to notice, enough to shift. That's why subjects reacted early. Not because they remembered, but because they had been tuned to the interval, not the input. No mind was changed, only its pacing. The danger wasn't what it did. It was how quiet the effect became. And if there's one truth buried in these erased sessions, it's that influence doesn't need permission, only precision. Some experiments vanish because they failed. Others because they succeeded in ways no one expected. This one didn't disappear. It was absorbed, diluted, renamed, until it no longer looked like a question. Just a result.